Welcome to the exciting world of emergency medicine. When faced with a medical crisis, it's these incredible drugs that hold the key to survival, from epinephrine's sudden strike to ephedrine revitalizing boost. Their impact cannot be overstated. In emergency medicines, first of all is dextrose 25%. Dextrose 25% is a medicine that contains a high concentration of dextrose. Dextrose क्या है? A type of sugar. Indications: hypoglycemia, fluid and electrolyte imbalance. Contraindications में आ जाता है hypersensitivity to dextrose, hyperglycemia, intracranial hemorrhage. Route: it is primarily used as an IV solution. Potassium chloride. Potassium chloride is a mineral supplement commonly used to treat low levels of potassium in blood. It is available in various forms including oral tablets, liquids and injections. Indications: hypokalemia, potassium replacement. Contraindications: hyperkalemia, severe kidney impairment. Route: the route of KCl injection is IV. Calcium gluconate. Indications: hypocalcemia, hypoparathyroidism, osteoporosis, hyperkalemia, hypomagnesemia. Contraindications: hypercalcemia. Route: orally, IM, IV. Injection isokit. Isosorbate dinitrate is primarily indicated for the prevention and treatment of angina pectoris. It helps to relax and widen the blood vessels, increasing blood flow and reduce the workload of the heart. Contraindications: hypersensitivity to isosorbate dinitrate, severe anemia, increased intracranial pressure, circulatory collapse or shock, severe hypotension, glaucoma. Intravenously or intracoronarily. Intracoronary means directly into the coronary artery. Injection aminophylline, primarily indicated for the treatment of the acute bronchospasm associated with asthma. Indications: chronic obstructive pulmonary disease (COPD). It helps to relax the smooth muscles of the airways, improving breathing and increasing airflow. Contraindications: hypersensitivity to aminophylline, severe or unstable cardiac arrhythmias, peptic ulcer disease, seizures disorders, hyperthyroidism. Route: IV, IM or as a slow release intravenous solution. Injection magnesium sulfate. Indications: treatment and prevention of seizures associated with eclampsia, treatment of severe asthma, treatment of torsades T points, prevention and treatment of preterm labor, correcting magnesium deficiency. Contraindications: hypersensitivity to magnesium sulfate, impaired renal function, heart block or myocardial damage. Route: IV, IM. Injection lignocaine, also known as lidocaine. Indications: local anesthesia, cardiac arrhythmias, pain management, ventricular fibrillation or ventricular tachycardia. Contraindications: hypersensitivity to lignocaine, second and third degree heart block, SA node dysfunction. Injection amiodarone. Indications: ventricular fibrillation, hemodynamically unstable ventricular tachycardia, maintenance of normal sinus rhythm in patients with atrial fibrillation and atrial flutter. Contraindications: hypersensitivity, severe sinus node dysfunction, second and third degree heart block, cardiogenic shock and severe hypotension. Injection dobutamine. Indications: acute decompensated heart failure, cardiogenic shock, stress testing in the alleviation of coronary artery disease, low cardiac output syndrome. Contraindications: hypersensitivity, uncontrolled hypertension, idiopathic hypertrophic subaortic stenosis, ventricular tachycardia and severe hypovolemia. Route: intravenous. Injection nalbuphine. Indications: moderate to severe pain such as post-operative pain, labor pain, and pain due to injury or medical procedure. Contraindications: hypersensitivity, severe respiratory depression, and acute and severe bronchial asthma. Patients who are dependent on opioids. Route: intramuscular and intravenous. Injection atropine. Indications: bradycardia, pre-anesthetic medicine to reduce salivation and respiratory secretions. Used to dilate pupils during eye examination or surgeries. Contraindications: hypersensitivity, narrow angle glaucoma, certain type of heart rhythm disorders, obstructive disease of the GI tract. Route: intramuscular, intravenous, and subcutaneous. Injection dopamine. Hypertension, certain type of heart failure. Contraindications: phenochromocystoma, a type of tumor that affects the adrenal glands, uncorrected tachyarrhythmias, ventricular fibrillation. Route: IV infusion. Injection tranexamic acid to prevent excessive bleeding in certain situations, heavy menstrual bleeding, to reduce bleeding in hemophilia and certain type of hemorrhage. Contraindications: blood clotting disorders or thromboembolic events. Injection hydrocortisone, brand name Solocartif. Indications: adrenal insufficiency, allergic and inflammatory conditions, rheumatoid arthritis, skin conditions such as dermatitis and eczema, ulcerative colitis, autoimmune disorders. Contraindications: hypersensitivity, systemic fungal infection, current vaccination with live virus vaccination. Route: intravenous, intramuscular, intra-arteriolar. Injection labetalol, generic name labetalol hydrochloride, brand name Trendate, Normodine. Indications: hypertension. Contraindications: asthma, bradycardia, severe hepatic impairment. Route: intravenous. Injection ketamine, generic name ketamine hydrochloride, brand name Ketalar. Indications: anesthesia, induction and maintenance, analgesia. Contraindications: hypertension, hyperthyroidism, severe cardiac disease, narrow angle glaucoma, increased intracranial pressure. Route: intravenous, intramuscular. Injection adrenaline, generic name epinephrine. Indications: severe allergic reaction, cardiac arrest, severe asthma, vasoconstrictor in specific medical procedures. Contraindications: hypersensitivity, tachyarrhythmias or ventricular fibrillation, closed angle glaucoma. Route: intramuscular, subcutaneous.